Assalamu alaikum. Good evening, good afternoon, everyone. Thank you very much for joining us into this interesting session. It's going to be conducted by Dr. Ghazwa Badr. We would like to welcome her and thank her for joining us today. Just a little bit of an introduction about Dr. Ghazwa. She has a very impressive CV. It was a harder function for me to figure out what to choose to reiterate here, but she carries a PhD in pharmacy with an honor degree from the United States. She has also some subspecialty training in pharmacy, internal medicine, residency pharmacy, and pharmacy practice residency. She's currently holding an assistant professor position at the Department of Pharmacy. I personally knew about her without her knowing about me, attending the GHOST conference. I was really impressed by the amazing pharmacy program and pharmacy training program to overcome the barriers that they were actually facing, training their residents. So it's really an honor to have her today, so she can share with us some of her great experience in that domain. And without further ado, we'd like to welcome Dr. Ghazwa, and the mic is yours.
Thank you so much, Dr.
Ghazwa, if you don't mind, I would like to remind all the participants to keep their mics on mute. Please do not hesitate to send your questions or inquiries the chat box, and we will address all your questions by the end of the session. Thank you very much. I'm sorry, Dr. Ghazwa, for interrupting you. We're back to you.
It's okay.
Thank you.
Okay. يعطيك العافية دكتورة, and thank you everyone. Thank you for this introduction. I really appreciate it. السلام عليكم جميعا, يعطيكم العافية. Thank you for being here in such a Friday afternoon. I believe a lot of us has a lot of other commitments, but so I appreciate coming and taking the time to listen to our experience at Princess Noor University. I'd like to also thank the Saudi Society for Simulation and Healthcare for giving me this opportunity to present our experience. And even though I'm here today presenting this experience that we established at the College of Pharmacy, Princess Noor University, I want to also thank, I'm here only on behalf of the College of Pharmacy staff and also the Skills and Simulation and Skills Development Center staff, because without of them, we could have not have this experience pulled the way it is, and to be even invited to present such experience without the team effort of all the staff. So without further ado, I'll just start by expressing that I have no conflict of interest in regards of the subject matter of this presentation. I would like also to start, I know I'm trying to make it more fun because I know it's a Friday. I would like to ask you, how would you feel if you were told that you would have 283 pharmacy interns going into the internship year at the same time, and you have to find them training seats? I will present to you, this is the emotional intelligence map, and I would like to hear, maybe I will pull, let me see if we can pull here, and it can be over. I can just write down, or maybe even through Zoom, I want you to imagine yourself in our shoes. I don't know if you have the screen now showing, or I have to share the screen. So this is, let me share this. This is the emotional intelligence map, and here are the feelings that everyone of us could feel, and it's even some of us might have multiple feelings of that. So I'd like to hear from the participant, even if writing down, please. How would you feel about that? Actually, exactly. I had all of this. I maybe at that time when I was in that situation, I felt all of those like anger line emotions that you can see in the anger line. I believe I had all of those in addition to the stress line. So I had all of those emotions together. I don't know if anyone can. I don't know if you can see it because there are a lot of scribbles on the emotions. Okay, knowing that, I feel that you feel confused. I can see the scribbles showing some confusion. So let's move on. So with knowing this kind of situation that we were having at the College of Pharmacy, PNU, I don't know if there is a way that we can remove the scribble so the screen can be shown. So going back to that situation that we were experiencing at Princess College of Pharmacy. So the estimated number of clinical training rotation seats, and by clinical training, I mean hospital-based for the ones who are not familiar with the pharmacy type of training, because some of the training for pharmacy graduates or interns should be sometimes at the community pharmacy and other companies. But by clinical training, for the site that we had available in the hospital in 2017 was covering around 37% of our interns. In 2018, it was also similar rate, but what happened in 2019 was extraordinary. We had 283 students at the same time that the clinical seats went down. There are multiple reasons behind this inflation, some of in the number. One of it was there was an exception in that year that we accepted double the students when they first enrolled to the College of Pharmacy. And at the same time, with the increased number of College of Pharmacies at that time, the seats went down that are available for each College of Pharmacy. So I'm just giving you an idea to put your shoes in our situation and how did we come up with this approach of training that we will be talking about. So going to the objectives of this presentation, it's just to share the College of Pharmacy experience in resolving, which helped in advancing pharmacy experiential training by integrating simulation. And the objective of this experience was to achieve the intended learning outcomes that we achieve with any clinical experience. At the same time, we had to increase the seats number available for the training and also student satisfaction. All right, so I'll start by introducing, talking a little bit about the College of Pharmacy at Princess Noor. We were established in around 2017, and the first and the first class graduated in 2014. Should I do anything right now?
Keep going. We're working on that. We're gonna listen to you, Dr. Sorry for that.
Okay. So we offer only one program, which is the PharmD program. It is a six years program where our students have the training within the program, within their didactic time, in addition to the last year of internship. So students have 3 training during their school time, and then the last year would be spent at the internship year. In that internship year, the students are supposed to take 9 rotations to complete their requirements. Each rotation would be 5 weeks. Should I stop sharing and share again? So I was talking that we have last year of internship that students spend 9 rotations, takes 9 rotations, 5 weeks per rotation. So I'll start also by talking about the PNU facilities. PNU is very well known for their unique educational programs, in addition to our unique and extraordinary campus that includes the Simulation Skills Development Center, in addition to King Abdullah University Hospital. King Abdullah University Hospital was inaugurated in 2017, and it's a secondary hospital that includes around 300 beds. The Simulation and Skills Development Center was established in 2015, and it is considered one of the largest simulation centers in the world, and it's accredited by the Society for Simulation in Healthcare. So the idea came about creating the Triad of PNU. So we have the College of Pharmacy, the capabilities that we have in College of Pharmacy staff. We have the Skills and Simulation and Skills Development Center, which has all the facilities that is needed for simulation and simulation room. And we had also King Abdullah University Hospital. So we kind of combined all the efforts of the three different, and I'm not gonna say the institute, we're all part of PNU. We just collaborated our effort to get, to establish this idea that we had in mind. So in order to integrate simulation into the experiential curriculum of our students, we had to, at the beginning, we had the problem identification. Part of it was what I was talking about at the beginning when we had the limited seats of training. And then after that, we did the need assessments for the target learners. We specified the goals and objectives, which mostly were the same goals and objectives that we are required to meet with any experiential training, or patient-directed experiential training, as we call it, clinical rotations. After that, we found that we also developed the educational strategies that we want. We implemented it, and then we evaluated and improved the experience, as you would see as we go along. So the problem was that, as I mentioned, we had need for training experiential sites. We need also for more qualified and trained preceptors. And this was also even mentioned in a study that was published about pharmacy education in 2017 by Prof. Al-Jad'i. And he mentioned that there are limited training seats offered in Saudi Arabia. And there is need to, one of the suggested solutions that he had in this paper was to implement simulation. So at that time, we know that we had the opportunity of having this simulation skills and development center capabilities. We had also King Abdullah University Hospital, even though the clinical service for the pharmacy clinical services were not established yet at that time, but we know that we have the facilities that we can collaborate with, and we have clinical trained faculties at the College of Pharmacy. So we had to look in the literature and see if there are any previous experiences about integrating simulation and advanced pharmacy education. By advanced, we mean the internship year. And there are several studies that looked into incorporating simulation-based education and pharmacy education. And the benefit was that they improved learners' knowledge, clinical skills and confidence, and also enhanced the interprofessional communication and team performance. So the benefit of simulation and pharmacy has been well established. However, we were also required as a pharmacy, as a College of Pharmacy, to follow the accreditation, the national and international accreditation standard, where they recommend to apply simulation-based education in interprofessional team, IPE, and the introductory pharmacy practice experience, which by the introductory we mean the training that's within the curriculum. But there was no mention by the accreditation body to incorporate the simulation in the advanced training experiences. And here was the gap, that there was no limited, even in the literature, there was limited information that assessed the benefit of using simulation or integrating simulation in the advanced pharmacy training. So what we did is we know that the requirements in the accreditation standard, the national and the international, that students should have at least 4 field experience that provided direct patient care, where they have to be in a clinical site at the hospital and providing direct patient care. We also have, but at the same time, we wanted to implement the simulation, but we know that we have some limitation, including that the faculty were untrained for simulation utilization. Faculty were also untrained to write and run simulation scenarios, and also the staff at King Abdullah University Hospital at that time were not introduced to the clinical pharmacy services. So we had those opportunities of collaborating. However, it required a lot of logistics to arrange between 3 different sectors or parts of PNUs, that facilities of PNUs, including reservation of the simulation center, especially that all of those facilities are shared facility. They're not owned by the College of Pharmacy. So we had to do a lot of training for our staff. We had to introduce King Abdullah University Hospital to this idea in order to incorporate them with us. And also we had to establish a scenario bank. A lot of the resources available online or available as scenarios mostly are directed to nursing or even medical student, but we had to tailor those to be fit to pharmacy education. So the goal was to integrate simulation-based education within the APPE or the internship curriculum to achieve the desired learning outcomes that were already stated with any direct patient care rotation. Those are required by the national, the NCAA or the international ACPE learning outcomes. The problem was that we had no previous framework to build on, since there was nothing in the literature that helped us, and we were not aware of any College of Pharmacy that has been establishing similar experience at that time, either nationally or internationally. However, we had the framework, the frame that from the NCAA, where we had the forms with the learning outcomes and the suggested strategies and how to assess, and those were used for the direct patient care, like any rotation that is provided at any of the hospitals. We had this in already, so we used it as a template for us, and we focused in that in 3 domains: the cognition, the affective, and psychomotor learning outcomes that we wanted to achieve. So here's an example of what we had already from the NCAA, but we had to modify. We had the course learning outcomes, the training strategies that were involved, an example of, and the evaluation and how we would evaluate. So I present here some of the examples that we had in the rubrics. Most of those, all of those experiential training are evaluated by rubrics. So I included some of the items that we had in the rubrics that were aligned with those learning outcomes. So we had knowledge, we had cognitive skills, we had interpersonal skills and responsibility, communication or affect domain was also evaluated, and each of those were incorporated in evaluating the students in the rubrics. So the objectives, the learning outcomes, the educational strategies were already clear. We also had to do a SWOT analysis in order to know what are the opportunities, the strengths, and the threats that we are going to be exposed to. So it would be more structured experiential education for students. They will have safe environment to learn and practice. They can be exposed to rare cases that they might not see during their hospital training, and also that all preceptors were from the College of Pharmacy. The weakness, however, was that there's no framework, as I mentioned, established before. The pharmacists were not, the College of Pharmacy staff were not fully aware or trained of simulation utilization. We had limited resources in terms of scenarios directed towards pharmacy students. We had multiple logistic arrangement to arrange at the same time, as I mentioned, between the university hospital, between the simulation center and the college staff, with all of the other educational duties that they have. However, we know that is an innovative experience. It will help us achieve the desired learning outcomes. It was at the beginning, it was structured to have multiple specialties in the same rotation, the 5 weeks. Like each week will be a theme, either pediatric or internal medicine or ICU. So it was as if we're combining several rotations in one rotation. It was effective utilization of the resources that we have at PNU, as I mentioned from before. So when we designed it at the beginning, the rotation would start at the internship year, where the student will spend 5 weeks, as you can see here. few days will be at the Simulation and Skills Development Center, and few days will be at the hospital. So the student will start by applying in the Simulation Center and then moving to the to practice under the same theme. So if this will be like internal surgery, then they will have few days in the surgery scenarios in the Simulation Development Center, followed by few days by real practice at the hospital, and then the next week would be under different theme, and so on and so forth, as you can see that. However, we got a feedback from students and from faculty that 1 week is really short for the student to get the full benefit of this experience. So we extended it to make it 2 weeks, a full week in the Simulation Center, followed by a full week in the hospital where they can practice on a real patient. So we did it, for example, surgery 1 week, then followed by surgery in the hospital. Same thing with internal medicine, and then they can recap with another theme at the last week of the rotation. And still, this was not sufficient for a lot of students. So what we did is actually made it all under the same theme, as you can see, where they get to spend 2 weeks in the Simulation Center with scenarios, and then they followed by 2 weeks in the hospital, and then they recap at the end in the Simulation Center. So this is an example of what the students would be doing within the simulation-based blocks, as we call them, because we call it like a simulation-based block and hospital-based block. So the faculty will do the dry run for preparation. They will follow then with a few days before the students are coming to this rotation, and then they will do the briefing when the students come into that day the Simulation Center, and then they would be given 30 to 60 minutes to prepare for the students to prep. After that, the faculty will be in the control room, and the students will enter the simulation theater, and we will have SP prepared or medical impersonated people also assisting us. And then after finishing the scenario, the faculty will do the debrief. Following that, the students will be given a journal club activity topic discussion regarding the same that follows the theme of the same scenario and the theme of that week. So at the end, this experience actually is continuing. We started it in November, I believe December 2018. It's continuing up to this now. But I'm presenting here the numbers and the outcomes that we measured from January 2019 until April 2019. So from January to 2019 until April, we had a total of 57 students who received this experience. Each integrated simulation rotation accommodate around 14 students. And let me tell you that we were running parallel. So we were running students in the Simulation Center. At the same time, we had students at the King Abdullah University Hospital, and then they alternate in order to accommodate the largest number of students at the same time. So the students who completed a full block of simulation-based, followed by a full block of hospital-based practice. Most of them had surgery, internal medicine, and pediatrics between January and April of 2019. So after implementing, we had to measure and evaluate the learning outcomes, because this is the goal of this experience. And we calculated the learning outcomes as we do it, as we do the grading of any clinical rotation using the evaluation rubrics, and the student will get the grade out of 100. We also looked into the feedback and the student satisfaction, because after each scenario that they were giving an evaluation to fill about the scenario. And also we got the faculty feedback through regularly meeting after establishing this experience, to get their improvement and how are the student, their improvement plan, if there is any suggested improvement plan. And as you can see, a lot of the improvement that has been done in the structure of this experience was based on student and faculty feedback. So here you can see the student achievement of learning outcomes. You can see that we compare the hospital-based and the simulation-based grades. And you can see that they're mostly similar. There's no, most of them were above 90 in this hospital-based and the simulation-based, but we had some simulation-based in some of the cognitive skills that were higher in the simulation-based, and when we measured them, it was statistically significant. Same thing with the interpersonal skills and responsibility. It was also high in both, we have to admit that, but it was higher in the simulation-based blocks, and also in the communication domain. Also, students had higher grades in the simulation-based blocks, which was statistically significant when we compared them with the hospital-based. In terms of student satisfaction, this is an example of these, the evaluation that they get by the end of the scenario. And you can see that the majority of the students had strongly agreed that they had benefited from the simulation, as you can see here. Those are some of the students' own words about the simulation integrated rotation by the end of the rotation. They had this written. You can see that a lot of them felt that they wish that they had it earlier in their internship year. And this is what we tried to accommodate later on when we had fewer students, that to let the simulation-based rotation to be at the beginning of the year, so students can go to the hospital after kind of practicing in a controlled environment. It gave them more confidence, and this was evident by even by the faculty feedback that we heard from them. So in terms of the impact of training seats, we had, as I mentioned, we had made around 14 direct patient care seats available to our students. We increased the number of direct patient care training seats from 14% in 2019 into 38%. By implementing this experience. We also saved around 25,000 riyals of training cost per rotation, utilizing PNU own resources. And we were lucky that we had these resources available for free, and that's why we're really appreciative of all what the simulation center offered us, from personnel into rooms and all the facilities that is available in the simulation center, and also the King Abdullah University Hospital. So the future direction was for this experience that it could be applied with even other health science colleges. We could, where each student from the health college can be a sort of an interprofessional education, where each will participate in their role instead of us or the students, or having SP impersonate physician or nurses. To embrace the interprofessional collaboration with the simulation-based education in order to enhance patient safety. The take-home message is that this experience presents a model of simulation-based experience that has been used in pharmacy training and can be used by other health disciplines. The intended purpose was not of sharing this experience was not to assess whether simulation-based experience training is more beneficial than than hospital-based training, or even we're offering an alternative. It will never be an alternative, because simulation-based education remains a method that cannot replace existing training in terms of pharmacy education or pharmacy internship. Let me talk and be specific. However, it supplements the hospital-based experiential training to enhance student skills, achieving the learning outcomes, increasing the student confidence, satisfaction, and may help, depending on the resources available in each institution, that may help also decrease the training cost by increasing the training seats available. Let me end by sharing a video that we had made about this experience. So I'll stop sharing, but this video was created to just go over the experience, same thing that I went over today. It was nice if we could have shared, but unfortunately, I apologize for that. So by this, I end this experience. It's also, we publish it at the beginning of this year, that goes into details, further details than what I mentioned today in this research. Let me also close by thanking all the pharmacy staff at Princess Noor University, all the staff at the Simulation and Skills Development Center, because we could have not made it through if we did not have a very effective team that worked as a team in order to establish this experience, and we became pioneers in it, alhamdulillah. So thank you so much for giving me this time, and I'll be happy to answer any questions.
Thank you, Dr. Ghazwa. It's, I would say it's really inspiring to see this coming to life, I would say out of scratch, and to see this baby evolving to such a mature and impressive program that I got personally impressed with when I heard about it during the GHOST. And before I ask my question, I would like to open the floor for our audience. Unfortunately, we ran into this issue and we had to disable the chat. So if you could raise your hand if you have any questions, and Dr. Ghazwa will unmute you. We'll give them a few seconds if any has any questions. Okay, I'll start by asking a question, Dr. Ghazwa. I was very interested. You clearly showed us that the student perception was amazing to this new modality. I was really keen to hear about the same question I asked Dr. Said in the previous lecture, is that the biggest and the significant issue is that getting the buy-in from the different stakeholder, students themselves. And I would like to hear that. And then from the faculty, because this is, as I mentioned, the biggest barrier that faces a lot of people who want to initiate a simulation program.
I don't know if you have the screen pulled right now. You can see it.
Yes.
Okay. I put it as a threat. I don't like to talk about the negative things, but I did not mention it, but I put it because I know. So actually, when you said that it is your baby and to see it coming from scratch, it was actually my baby. It was our baby, let me say more appropriately. So I had students when they they knew that they were scheduled for a simulation, which was called the simulation rotation. We called it the integrated pharmacotherapy rotation. When they knew that they would, the location of their rotation is the simulation center, they kind of felt that it's a scam and we're just running out of training sites and we're just creating things out of nothing and just to let them go and train. And I had students, at that time I was the dean, and I had students coming to me and asking, it's please doctor, I will not take this rotation, it's at the simulation center, and I'm a high GPA student and I should be practicing at the hospital, and they were resisting. And I told her only one thing. I told her, listen, I've been involved in this from the beginning. I want you to come and talk to me after you take even the first week or the second week of this rotation, and we can talk if you think that you're not benefiting from it. I even had to go at the beginning because I knew that it takes only one batch of students to tell the other batch of students. I know that we had to do our best from the beginning for the first batch in order for the others to be to tell their colleagues that they benefit from this experience or not. So at the first day of this rotation, when we first started, I had to go myself and talk to the students. And I told them that a lot of people will think down of you that you took a simulation rotation, but you're actually way advanced. You took something that myself, I did not experience when I was in the States. So you're way advanced than a lot of people who might be ignorant about simulation. So just bear with us and see and give yourself the chance to learn and benefit from this. And it just, as I said, it just took this batch, and students were starting to ask for to take this rotation, to be scheduled for this rotation. This in terms of students. The other part of of pharmacy faculty, yeah, there was some bit of resistance, because there is resistance to any change, and there is resistance to any new thing. It's not because our faculty were not cooperative. They were actually very cooperative, especially when we provided their needs. We had to sit and learn what their needs, and their needs was that they had to have training about using a simulation. They had to know how to write a simulation scenario. And at the end, we have something that we're very proud of, that we established, like maybe the largest, I would say, at least like in Saudi Arabia, the largest scenario bank of pharmacy related cases. And now simulation, because simulation is very enforced in PNU, that us as a faculty were required each semester to submit a scenario to the scenario bank. It's like one of the evaluation criteria that we have, and we have to meet this KPI, that each semester we have to submit a simulation scenario to enrich the bank that we have.
That's amazing, Dr. Ghazwa. Again, you're coming across very important pearls, if I would say, that functions at multiple levels to get the buy-in, at the managerial level, as you mentioned, enforcing the simulation culture at the department level, sharing, keeping people in the loop, and at a trainee level, again, keeping them in the loop and having this like personal, mature conversations with your candidates clearly showed the outcome, clearly showed the effort. It's again very impressive, and I was so happy to see that published, because I think it's going to be a benchmark to a lot of pharmacy programs. As you mentioned, I have never came across this before, and we are so proud that one of us actually led this project at many levels. I don't know if you would like to have multiple remarks. Unfortunately, blocking the chat and the participants has resulted in significantly less attendees than we expected, but unfortunately we couldn't take another technical hacking issue, because it's such a precious talk. And I would pass the mic back to you if you would like to make any remarks or comments.
Actually, I shared most of it in the presentation. I would be more than happy to collaborate with any institute that wants to establish them and share whatever we have. It's not about that we're the first, but we can be the last in a few years if we don't continue to develop. And this is what's happening right now at Princess Noor University. We know that we're sharing and we're very proud of it, but we're continuously developing this experience so we could be pioneers in it. I mean, we're, as I mentioned, we're opening all of our doors for any collaboration with any university that we could help. And I look forward not only for colleges of pharmacy to establish, like I have an idea in mind to do this for as a theme, as we do it for a theme for all health colleges, about a theme about medication safety, which is one of the things, or patient safety, let me call it, which one of the things that all health disciplines are working for this goal. So again, I hope that I answered a lot of questions that any of the audience had at the beginning when they heard about this experience, and I'll be more than happy to collaborate with any university or any institution to establish this and take it to a further step with PNU.
Thank you again for having that sharing and team working spirits, Dr. Ghazwa. And I'm sure that you're going to hear a lot from a lot of people who are interested to implement or at least to mimic this amazing program. I don't see any more questions, and it was our honor to have you, and you're actually the last guest in this Simulation Week agenda. So let's say it was last to have you, and since we're seeing no more questions, we will conclude our session. Dr. Ghazwa has already told everyone. If you have questions that unfortunately due to the IT issues were not answered, I'm sure that she will be more than happy to answer you via Twitter or her whatever communication method she has.
Yeah, and I have my email even pulled here.
Perfect. So her email is there. Please reach out for her. And it's a pleasure to have you again. Thank you very much, everyone, and enjoy your Friday for today. And have a wonderful evening.
Yeah, I want to thank everyone for coming on Friday afternoon. We have to really applaud them. Thank you so much for your time. I really appreciate it. Thank you for this
everyone.
opportunity.
Thank you.
Bye-bye.
Bye-bye.